Thank you, everybody, for joining the program. Thank you, everybody. Thank you all for introducing yourselves in the chat box. We're very, very grateful to God that we're able to honor our teachers again in 2025. And I would like to kick off the program and start right away. I'm standing on behalf of the chairman of the Rehoboth Dream Solid Foundation, Olalekan Olusoga Joseph, Rear Admiral retired, CON, MNI, and of course, on behalf of other distinguished trustees of the foundation. On behalf of all of them, I welcome you all to this program, to the 2025 webinar in honor of our teachers. We have done this program before. It's not the first time. We've had several of these workshops and webinars. Some of the trainings are accompanied by follow-on classes sponsored by the foundation, and we do this to enhance the skills of our beneficiaries. However, we host a special webinar in the last quarter of every year as part of our annual Rehoboth Teachers Excellence Award program. And this is a program that we organize to celebrate public secondary school teachers that have exhibited excellence in the discharge of their duties. Of course, not just secondary school, every teacher, every educator, we're proud of all that you do. And the foundation seeks to celebrate you in the last quarter of every year. Today's webinar, the title, it's our 14th webinar, and the title is Health Kidney, Healthy Life, Everyday Tips for Kidney Care. We have recordings of our past webinars on our YouTube channel, and our YouTube channel is the name of the foundation. If you search for us online on YouTube, we are Rehoboth Dream Solid Foundation. And we have a recording of all the webinars, not only the ones that we do to honor teachers. Every webinar that we do, we upload online. We won't take too much of your time today. We expect that the program will take 1.5 hours. After this introduction, our guest speaker will take the floor for 60 minutes, and we'll give him a break to take a cup of water, and then we'll do Q&A, and then we will have a wrap-up. I anticipate that the 1.5 hours will be very valuable, and I'm looking forward to learning so much. Now, I would like to introduce our guest speaker, Dr. Olalekan Ojo. He is Dr. Olalekan Ezekiel Ojo, is a distinguished Nigerian nephrologist with over 2 decades of clinical and research experience. Dr. Ojo has held key clinical and academic positions, and he currently serves as a consultant nephrologist at the Federal Medical Center, Owo. He is also the current National Secretary of the Nephrology Association of Nigeria. His commitment to advancing nephrology care and education in Nigeria and Africa marks him as a leading figure in his field. We're privileged to have him join us today in marking this year's Teachers Excellence Award. And I do thank you so much, sir, for working with us and creating the time to be part of this program in spite of your busy schedule. We look forward to you enlightening us on this topic, and I'm very eager to learn from you, sir. Thank you so much. We do not take our guest speakers for granted. We know how busy you are. I think sometime last week you were still in America. We know most doctors are very busy, and so we acknowledge the sacrifice of you making time to join us today. Thank you so much, sir, for joining us.
Thank you very much, Madam Mrs. Komolafe, and I want to especially thank the Rear Admiral, even though we've not met in person, but his simplicity and humility is highly impactful, and the team at Rehoboth Foundation. May the Lord bless you in Jesus' name. And I want to join you as we commemorate the Teachers Appreciation Day, because as we all know, teachers happen to be the foundation of whoever and whatever we become. And most times we remember every other person but the teachers. So once again, thank you for the great job that you are doing. And want to also thank the teachers Today we're going to be talking about healthy kidneys, healthy life. And we will simplify it. We're going to be looking at the practical knowledge and everyday tips to protect kidney health. And like I said, our intention is to empower each participant with practical knowledge and everyday tips to protect your kidney health. So now, as you can see on the screen, we have these two organs.
Sir, have you started sharing your screen?
Oh, sorry, I thought.
Yes, it's starting now. Thank you so much.
Thank you very much. So the kidneys, there are two bean-shaped organs, and they are located below the rib cage. So if you see, so you have one on either side, that is one on the left and one on the right. And there are a number of essential functions that they perform. So one after the other will be highlighting the functions of the kidney in health, and then we will now move on to look at what happens if disease ensues. So in no order of importance, the number one thing we are going to be looking at is that the kidney filters waste and excess fluids from the body. So as you go about your daily operation and everything like that, wastes are generated. The waste is carried, or they are resident in the tissues, carried about in the blood, and then the kidney serves as a filter to take out the waste and fluid that is in excess from the body. Another function of the kidney is that it helps us to regulate blood pressure through hormone production. So the kidney has its hormone that it produces in response to the blood pressure of an individual. So these hormones can increase or reduce depending on the level of the blood pressure of the individual. Then the kidney helps us to balance some electrolytes in the body. So the electrolytes like calcium, sodium, potassium. Now, the schema or the diagram that we have here, you see the kidney, and then out of it, we took just one of the nephrons, because the nephron is the functional unit of the kidney. And the blood goes through a lot of processing, and then the waste is taken out. So at different levels of the nephron, exchanges occur such that the sodium in the body is what level it should be, the potassium is at what level it should be, as well as the calcium. Of course, there are some other chemistry parameters that the kidney handles, but we are not going to be boring us with too much details. Then
Hello, sir. Hello,
yes,
sir. Sorry,
yes.
I'll just steal a second of your time. Could you please make it full screen views?
Actually, I was looking for the slide screen.
Should be at the bottom.
I was looking for it, really.
Mrs. K, can you check and see if you can guide that? I thought
Only
it's supposed to be.
I wanted to do the slideshow, but I can't see.
it's at the bottom. It's
I
the
know that it's usually at the bottom.
it's the big.
Excuse me, I'm coming.
Yes, yes.
It is not.
You can continue, sir. Maybe I would try and pull it up here.
Okay.
So you can
Sorry.
continue. It's okay, sir.
Yeah.
Mrs. K, you can put it on and control it from there. Wait. Great.
Can you please mute yourself, Admiral K? Thank you.
Okay. Do I settings? Let me seconds. No, it's not. Okay, great. So, can you see now? Hello?
Yes, sir, it's good. It's good now. Full screen. Thank you.
Yes. So now, the kidney also helps us in activating vitamin D, which has a lot of roles to serve in the body. So there's an interplay between the skin, sunlight, the kidney, and then we have vitamin D, which is very essential for bone health. So the kidney also plays a role in that regard. Another very important function of the kidney is that it helps us in the production of um, a particular substance that we call erythropoietins, which is what stimulates the formation of red cells that we see in the blood. So the red cell is what impacts the color on the blood. But the red cells themselves, they have what we call a lifespan. So when the red cell, the quantity is what we assess when we say we are doing PCV or packed cell volume. The way God designed the body is such that there is something that senses um, the level. If it is below optimal, the kidney is that organ that reduces or releases erythropoietin. This erythropoietin goes to the bone marrow to form the red cell. And then these red cells carry oxygen that is used for the body to, the tissues of the body to function optimally. So we've looked at the various functions of the kidney. That is when the kidney is in health. The kidney can be diseased. And what are the common causes of kidney diseases? In this environment and most parts of the world, the number one cause is high blood pressure called hypertension. And oftentimes, hypertension is undiagnosed because hypertension does not give symptoms. So if an individual does not seek help to check his blood pressure, he might carry it for so long, or even when individuals develop hypertension, they are poorly managed. So a poorly managed blood pressure or undiagnosed blood pressure over time can lead to kidney disease. Another cause of kidney disease is diabetes mellitus. About 50 years ago, it was said that diabetes mellitus was rare in this part of the globe. In fact, as Mrs. Komolafe said the other time, I was in the US and I saw a man in his 90s. He's still practicing medicine. And he asked which part of the country, of the world I was from. I said Nigeria. So, he asked the question. He's a nephrologist like myself. He said, "Do you see diabetes in Nigeria?" I said, "Of course." And by the time I told him the prevalence of diabetes in Nigeria, he was surprised because he practiced in Nigeria in the 60s. And then he said, at that time, we don't see diabetes. But I tell you today, the diabetes burden is so high that it is as common as pure water. And there are reasons why people will develop diabetes: poor diet, sedentary lifestyle, that is, poor or reduced activity. So people gain weight, and then sugar and some other hormonal interactions are not functioning appropriately. And this impacts on the function of the kidney. Another thing is chronic glomerulonephritis. Well, I will just leave that one. Then another one is chronic infections. Infections like urinary tract infection, hepatitis B, hepatitis C, and HIV. All these can damage kidneys over time. Another cause of kidney damage is use of herbal remedies and unregulated medications. This is very popular in Nigeria, and I tell you, they are often nephrotoxic. Nephrotoxicity talks about harm or injury to the kidneys. I've been asked in several fora about the fact that orthodox medical practitioners seem to frown at the use of herbal remedies. That is not exactly so. The issue with herbal remedies is, one, we don't know the component. Two, we don't often know what strength should be administered. Three, they do not undergo what we call regulatory assessment. Somebody just wakes up in the corner of his room. In fact, it's become worse now in the days of social media, that somebody, in fact, they even say to my face that there's this vegetable called ebolo. If you cut it, you soak it in water, you drink it, you put the water on the surface of pap to something and everything like that. So different herbal remedies. In fact, there's a patient that I'm managing today that has a kidney disease, and what is responsible? It is this abnormal use of herbal remedies and then unregulated medication. Unregulated medication, you see, Nigeria is one of the few countries in the world that you can get any medication over the counter. In fact, in the rural setting, you see people hawking medication as though it is grocery. And then everybody is an expert. A number of times when I go to the pharmacy to buy something, somebody just comes, give me akapo. Akapo is a Yoruba word for a combination, and oftentimes is a multiplicity of pain relief medication: diclofenac, ibuprofen, paracetamol, and all. So they will combine everything together. And by the time all these are used over time, it constitutes or it leads to damage to kidney. Of course, dehydration and stress. In the past 5 to 10 years now, in the nephrology world, we've identified an entity called CKDU, chronic kidney disease of unknown etiology. And in fact, there is one of my colleagues that we were together in the US who is working on that. We have seen that in farmers. It's been documented in Venezuela and Kenya, and we are also looking at it in this environment. And I tell you, it is not unlikely that we're going to see the same in some of our teachers who work in hot environment and don't take sufficient hydration. And I tell you, low awareness and late diagnosis is an issue. And many Nigeria patients discover they have kidney disease at advanced stages. And now, what are some of the less frequently discussed causes? I would say less frequently discussed, not because they are not there, but advances in the medicine has made us to now know that these things exist. On this list, I have number one here: autoimmune disorders. By autoimmunity, we are saying that for some unknown reasons, some cells or the tissues of the body begin to fight self. On a normal day, if you are a family member, there should be no fight. So your self cells should accommodate themselves. But for some reasons, the cells of the body refuse to recognize another cell of the body as being self. So, and one of the commonest autoimmune disorder is lupus disorder, systemic lupus erythematosus. We don't mention names, but if an individual goes online to let us know this is the condition he suffers, we can readily refer to that. I don't know how many of you know this lady in Nollywood. I think, is it Kamala? Well, that is the condition that she has. You understand? She went online. You can Google her name. I think that's something like Komalafe is her name. So she developed systemic lupus erythematosus, and in fact, as we speak, this morning, I lost a young girl from this condition. Another one is IgA nephropathy. Now, in IgA nephropathy, the kidney is diseased and then hearing could be affected. Then IgA nephropathy is a cause of, immune deposits. It's Alport syndrome I was going to talk about, where the individual could have kidney function, hearing, and vision. Then another entity is polycystic kidney disease. Now, a healthy kidney is firm, but for some reasons, some of them will develop some cysts, and the cysts grow over time to impair kidney function. And many of the times, it runs in families. So if a member of the family has cysts in the kidney, it can affect another member, and it has implication in management. Then we have some other rare glomerular diseases like focal segmental glomerulosclerosis, membranous nephropathy. Then we also have some infectious and inflammatory conditions like tuberculosis. Tuberculosis of the kidney is possible in areas where we have ITB prevalence and insufficient treatment. Of course, we know that tuberculosis most of the time affects the lungs, but it is not just the lung that the tuberculosis could affect. Then we also have schistosomiasis. You remember schistosomiasis is a parasitic infection that affects the urinary tract, and it can also affect the kidney. Then we also have drug-induced nephropathy. Like there are some individuals that are taking some treatments, maybe for cancer. The drug can affect the kidney. Then we also have contrast-induced nephropathy. So that is why when some individuals want to go for some radiologic procedures like CT scan, one of the things they will say is go and do your E and U, is because they want to see how the agent can affect the kidney. Then we have obstructive or structural abnormality, which can occur, one, from kidney stones. Like we said, the kidney serves as a filter, but when the concentration of some of the substances in the body gets so high, they can accumulate and block the filter, and they will form stones. And it could be very serious to manage. Then we have congenital anomalies. Congenital anomalies talks about conditions that develop while the child is growing inside the uterus of the mother, and they can impair kidney function. Then we also have some rare systemic diseases that, for instance, would deposit in the kidney, like in amyloids and sarcoids. And so then the other thing are some substances that are found in the soil in a number of regions. For instance, in the north, we have identified around Guzo, Adagea axis, some cases of kidney disease. And we are discussing this with the federal government, and also even in our state, we are trying to look, because looking at the patients who come for kidney care, we have identified an area where it seems there's something about the environment that is responsible. In Zamfara, there is lead and all those other things. So there are so many things that affect the kidney, and we need to be very much aware of them. Now, what is the burden of kidney disease in the world and in Nigeria? Globally, that is all over the world, about 850 million people suffer from kidney disease. And currently, chronic kidney disease ranks amongst the top 10 causes of death. In Nigeria, it affects about 10 to 13% of the population. That is, of every 10 people in the population, we have 1 plus that has kidney disease. And like I said earlier, late diagnosis and limited access to dialysis or transplant service will worsen the outcome. Now, I want to move on to something that we need to quickly clarify. And that one I titled, What are the misconceptions and the knowledge gaps? One misconception about kidney disease is that kidney disease only affects the elderly. It's not true. There is a specialty in pediatrics. Pediatrics talks about the care of children, that we talk of pediatric nephrologists, nephrology. So the doctors there are the nephrologists, pediatric nephrologists. They have a lot of children. So in essence, I'm saying that kidney disease does not only affect the old one. So people will be asking the question, "Omoni Keride new is a young one. How come he's having kidney disease?" It is not a condition restricted only to the old ones. Number two, another knowledge gap is that when somebody is fatigued, has some body swelling, and there are changes in urinary pattern, volume, or frequency, they get ignored. It is not good. And then we have limited knowledge about how to prevent kidney disease, especially in the rural communities. Now, I want to move on to talk about the myths and the facts about kidney disease stemming from the knowledge gap that I mentioned. One myth is that people often say drinking a lot of water cure kidney disease. But please, I want you to know that the truth or the fact is that hydration is very helpful, but it does not cure disease. Number two is that people will tell you, since herbs are natural, natural things are always safe. So herbal remedies are always safe. But please, the fact is that some herbs can harm the kidney function. This is why you need to consult your doctor. Number three is that if somebody has kidney disease, that the symptoms will show very early. From my own experience, which is over 20 years, I can tell you that kidney disease often progresses silently. In fact, a number of my patients, when I see them and I tell them that what they have is end stage, because we have a way that we classify kidney disease. The final stage is end stage kidney disease, kidney disease. Some of them, in fact, I've seen 2 or 3 of my patients. Interestingly, some of them have undergone kidney transplant. In fact, one of them is a very highly placed individual. He saw me, and in our first interaction, I told him, "Please, Oga, what you have is end-stage kidney disease." He was so annoyed. He said, "How can you see me for the first time and tell me that what I have is end-stage kidney disease?" And then, well, we don't argue. He traveled abroad. He went to one of the Western countries, And 6 months later, he just snapped a photograph. Said, Dr. Joe, I'm sorry for the way I related with you the other time. He's now wearing, he was wearing something for dialysis. And today he has undergone kidney transplant. So it can, I mean, a patient can present for the first time, and at the time that is presenting is already in end stage kidney disease. Another myth is that only alcohol affects the kidney. It is not so. Of course, alcohol in a measure can affect blood pressure, that can affect the kidney, but there are many other things that can affect kidney. High salt, sugar, non-steroidal anti-inflammatory drugs, like I've said. In fact, drivers, farmers, they take a lot of this stuff and it affects the kidney. So it is important for us that we are mindful of medication use and we take balanced diet. Now, what are the daily tips that we need to have to maintain our kidney health? We have different groups, one of which is the National Kidney Foundation, and then plus some other sources. These are the things that we need to do. Number one, you need to stay hydrated, but please do not take too much water. Well, if there is no problem in any case, you know when to limit your water. But please stay hydrated. It is good. Number two, limit salt and processed food. In those days, and I will call it those days because I believe that many people have adopted our recommendation, it is not uncommon to have on the dining table different cups, one for sugar, one for pepper, and the other one for salt. Please do away with the salt shake, and then limit how much salt you take. And more importantly, processed food. There are like three functions of the salt as a seasoning or spicing agent, as a preservative. And as a preservative, it kills some microorganisms. But as it's killing microorganisms and makes the life of the substance to be prolonged, it is also injurious to the health of the individual. And most processed foods are preserved with salt. So it's good to go natural and limit your intake of processed food. Eat your fish. By the time it is canned, a lot of salt is involved. Some of those cereals and all the other things that you buy, even for our children, a lot of these things have been added. And then control blood sugar and blood pressure. Now, before we can even talk about control, it is good to know what are our values. And there are some things that we say in this part of the globe that are not funny. I've seen patients often. It is not, in fact, it is very, very common that every week, at least one person, I don't know whether they think it's a testimony. We say, look, you have this condition. They say, and one thing about me is that I don't see doctors. I tell you, it is not a testimony. Because one of the simple ways by which I address it with those individuals is, do you have a car? And they say, yes, he has a car. In fact, he has many. And then the next question is, when last did you service your car? In fact, a number of them will remember the last time the car was serviced. And then the next question is, did you wait for the car to get spoiled or the engine to knock before you service? No, I can't afford that. So they are so finicky about the car health, but not their own. The same way that as you are burning the fuel and the oil, it needs replacement. as we are growing old, certain things about the body will begin to take some form. So it is good to know what is your blood pressure. And if an individual is diagnosed with blood pressure elevation called hypertension, there are drugs, there are lifestyle processes to adopt to make the blood pressure to be under control. The same with diabetes. It is not true that the fact that somebody has hypertension or diabetes, he must die. There are people that have lived longer than some of us. I mean, they have had hypertension longer than some of us have lived, and they are still living because they take heed to what pieces of advice we give. Avoid alcohol. Avoid smoking and alcohol. Next, exercise regularly. Next, use medications responsibly. Now, if it is impossible to regulate what medication can be bought from the pharmacy, you use only what is prescribed for you. And there is also another common thing that we do in this part of the globe. Two individuals who have different diagnoses, they will not bother to see the doctor. Say, oh, the leg is swollen. I say, leg swelling can be for many things. For instance, somebody who has occlusion, blockade of the vessel that is draining the leg can have leg swelling from what we call deep venous thrombosis. Another person can have leg swelling from accumulation of water. So somebody came to see a doctor today and they said, this is deep venous thrombosis. Take this drug to do this and everything like that. And then the person that has fluid accumulation collects the drug for deep venous thrombosis. So many people have died because of such things. So please take medication responsibly, especially painkillers. So what are the future directions on kidney health? And like I said, we really appreciate the Rehoboth Foundation. We thank God for the teachers. And on our own, in my own institution, I'm just analyzing the data now. We have gone to schools, at least in our 3 of the schools. We screen the teachers and the non-teaching staff. But beyond that, we need to do early screening programs in schools and community. You have heard this statement before, that prevention is better than cure. It is not only better, it is cheaper than cure. So when we screen early, we look at urine, we look at the other things. If an individual is at high risk, that person will be referred to the appropriate physician. The second thing that we recommend is that we should integrate kidney health into the education curricula, such that the teachers are aware and the teachers are teaching. And you see, one thing about these children is that they are highly impressionable. The moment you tell them, if you see this, it is equal to this, then they just carry the thing and it becomes part of them. And then the next one of our future directions on kidney health is that we need a lot of advocacy for affordable dialysis and transplant service. And I must give it to this government. They are trying to ensure that this is done. But I can also tell you, if nothing is done, especially with respect to the health insurance, we might not be able to go far, because the cost of dialysis is so humongous that nobody can afford it, and transplant service. So we need to strengthen the health insurance. And then data research. So as we have had this now, like I said, in my own group, we've gone to schools and I'm analyzing the data. We also need to engage in research and data collection so that when we are talking to issues like this, we can tell the government, this is what we have seen in Owo. What is there in Ondo? What is there in Rivers State? What is there in Sokoto? What is there in the Gambia? And then we can now use this to guide policy and funding. In concluding the talk of today, I want to say once again that teachers, You are pillars of the society. Your health is vital to the nation's progress. And by adopting simple daily habits and spreading awareness, you can become champions of kidney health in your classrooms and community. Please, let us commit to a future where kidney disease is preventable, detectable, and treatable. Thank you, and happy Teacher Appreciation Day. God bless you.
Thank you so much, sir. I don't know. I'm a teacher. I'm a teacher's daughter, and I once thought I would be a doctor before chemistry, physics, and biology told me I would be an accountant. I'm very grateful to you, sir, and not only to you, to your association, and to everyone in the healthcare sector. Between the healthcare sector and the educators, I'm in the middle. I don't know which of you that I appreciate more. But on a serious note, we are very grateful to people like you, healthcare practitioners, and we're very grateful to the teachers as well, because your both professions are very important. We're going to give you 5 minutes to take a cup of water, and then we'll come back with our questions. I have some questions for you. Edison, over to you for the poll you want to run.
Okay, thank you so much, Ma. Thank you so much. I've been trying to tell everyone not to put the referral code on the chat box. So I'm going to be launching the poll now, where you can now, answer the questions and, sorry. Okay, so I've launched the poll. It's going to pop up on your screen, and then you can quickly take the 6 questions, and that will be all. They're just 6 questions. You can start now. Please, that is where we automated the process. So we are not going to be counting what is written on the chat box. Please don't put it on the chat box. You can put your questions on the Q&A box. It's more or less like a question mark sign on your screen. You can put your questions there so that your questions can be taken. Yes, I can see that a lot of persons have started submitting. It will pop up on your screen. Just fill it and submit. Thank you. Keep them coming. We are 239 on the call. Keep them coming. If you're watching on YouTube, you can definitely type the your referral code there. We'll take it from there. But these are the 2 channels that we have provided for this.
Is it Paul over?
No, you can continue. It's they will just fill, and we can start taking the questions. I'll leave it on.
Okay.
Yes.
Okay. Do you expect that I should start now?
Yes, I would be asking you the questions, sir.
Okay, thank you very much.
Yes, it's been a very, very enlightening session. I think even though we have medical jargons in between, but it's very obvious that you're so used to speaking to non-medical people because you simplified it. I had so many questions, and the presentation, every time I had to cross out the question, I'm like, Dr. Joe has answered this question. And it also shows the practical experience, from the people that consult with you. And thank you so much. Every element of the presentation is relatable and very easy to understand. I want to start by asking you a question, sir. And because I mentor people and I speak to a lot of people, you talked about untreated UTI. I think you used the word recurrent UTIs. So I want you to talk about the impact of the recurrent UTIs on the kidney. And my question is, if someone keeps having UTI, which I think is urinary tract infection, over and over, and which is the use of the word recurrent, when a person gets treatment for it, like it keeps happening, you get a treatment, it comes back, you get a treatment. What's the impact on the kidney if the UTI that keeps coming back gets treated?
Okay, thank you very much. We have a way of classifying urinary tract infection. We talk of simple UTI or uncomplicated UTI, complicated and recurrent UTI. If somebody is having recurrent UTI, it could be because of the habit. And what do I mean by that? For instance, if you look at the genitalia of the female, it is different from that of the male. The genital of a man projects out of the body. That of the female flushes with the body. So if we don't know how to clean, and it's as simple as this is, you won't believe that I have a colleague, she's a professor, who keeps on having recurrent UTI. So I have to take her through this simple thing. You go to the toilet to poo, that is to defecate. If you want to clean, you clean from forwards back. But as a woman, when you are cleaning from backward forward, the arrangement is such that the anus, vagina opening, urethra. So when you clean forward, you can inadvertently introduce some microbes, and these ones have a way of ascending. So, I mean, that is an innocent thing. So it can happen like that. So just simple counseling can prevent that. But again, like we said, the urinary tract is supposed to be a tract. There shouldn't be any hindrance to flow. But oftentimes, we might have reasons why there could be hindrance to flow. The hindrance to flow that we call obstruction can be from 3 levels. Within the lumen, that is within the pipe, in the wall of the pipe, or outside the pipe. Within the lumen, it could be a stone. I said the other time that there are individuals that we call stone formers. So if somebody forms a stone, the stone will be an impediment on the path of urine flow. And once there's an impediment, just imagine a gutter that is a stone. Or even if you use a mesh in the gutter, it would be a nidus for other things to accumulate around. And that is what happens. So something that should be flowing, when it becomes stagnant, then there could be multiplication of microorganisms, and then it can ascend. So when it ascends and it involves the kidney, we call it pyelonephritis. If it stays long enough, the damage to the kidney could have been so severe that even when you remove it, nothing can be done again. And that is where we talk about chronic kidney disease. Another thing that can happen is that, for instance, we talk about schistosomiasis. So there could be a stone of schistosomiasis. Then talking about the lumen, there could be something around the tract. Then talking about outside, fibroid can compress on the ureter. Prostatic enlargement can compress on the bladder, and all of this can cause fluid, because when you urinate, if water is flowing all through, you hardly ever will perceive any odor. But once there is stasis, there could be odor. That's when you have people now having, recurrent UTI. So we usually evaluate, why does this person have recurrent UTI? And like I said earlier, even from the childhood period, there's what we call posterior urethral valve. In the developmental period, there's a valve that should not be there, but some boys do have it. So when we see it in children, we don't overlook. Because I mean, that's why you will see. So I mean, I've had to manage a boy who entered into end stage at the age of 14. It's because there was a posterior urethral valve that was not taken care of. I mean, not their fault, but somebody did not know. And because of the fact that we have unregulated use of medication, so somebody say, go and buy amoxicillin. So you keep on treating the symptom, not addressing the cause. So if somebody is having recurrent urinary tract infection, what we do is to evaluate why. It is not enough to just treat why. And sometimes once we're able to treat it early, it does not lead to chronic problem.
Thank you so much, sir. At a point, I didn't see any question in the Q&A box, and I thought it would be only my question that I would be asking. But now there's so many questions. But I have one of mine, one last one before I go to the box. I mean, the reality, I keep saying, because I'm a teacher's daughter, the reality is that, the educators are not as well compensated financially as they should be, which is one of the reasons why the Rehoboth Dream Solid Foundation takes it upon herself to celebrate educators and acknowledge their work with us. Most of the time, they don't have access, not only teachers, most of us in Nigeria don't have access to affordable healthcare. We see all these women, well, men sometimes putting these trays on their heads. I know you have talked about use of medication. You've talked about us being careful about self-medication and all of that. Now, I'm looking for the question, the way to put it to you. We all do self-medication because of the cost. I don't know what you advise. I know there are general hospitals and the teaching hospitals, but the queue is long, and the stretch is sometimes endless. Now, how do we balance affordability for healthcare and taking care of our kidneys?
What the question you have just asked is very germane and cannot be overlooked. However, I usually engage whoever has this kind of complaint in another form of, should I say, rhetoric. Let's look at it this way. If somebody is complaining of the fact that, I'm not saying don't complain, no, we should, because we should be better. But if you come to the hospital, the queue is long and everything like that. But at the end of the day, you are seeing, yes, a day is lost. It is bad. I don't like to use the word proper places, but in many developed parts of the world, they try to see how to limit this thing. But again, number one, in our own setting, in the Nigerian setting, what are our peculiarity? I just returned from the US. In the institution, not the state, the institution where I went to do my program, they have 30 nephrologists, 19 of them are professors. Not in the state, I mean, okay, let me tell you, in the state of Virginia, one institution. Now let's come to Ondo State, where I practice. We have 3 active nephrologists. In my own institution, I am the only nephrologist. So if they need to say nephrologist in Ondo State, okay, well, we have a pediatric nephrologist. So let us say 4 active nephrologists. So one, and in the whole of the state, only 1 pediatric nephrologist. Now, there is now a nephrology consult. 20 patients have come. Even if I'm going to use 10 minutes, it means 10 times 20. And there is no way your consultation can just be 10 minutes to address a concern. So if you are coming, understand our peculiarity. That's number one. Number two, the rhetoric that I was talking about, if because you don't want to stay for 2 hours, you now incur a problem that is going to stay for life. So which one should be the trade-off? Number 3 is that we should seek information from the right sources. Let us not go and be asking a bricklayer for a plumbing job. Seek help in the appropriate places. But there are some individuals who actually do all the above. And I tell you, it is disturbing that they've done everything. For instance, somebody who has rapidly progressive disease who came, but the condition is progressing. Well, we would write everything that they need. Like I mean, as I'm talking to you this morning, there's a patient that I've seen, and the condition is such that he needed to be treated, and the thing we needed to buy for him is about 2 million for a session. It's unfortunate. The question you're asking me, I remember I was in Hong Kong about 2013, and the man said, Dr. Ojo, if they can't afford it, what do you do? I looked at him because he looked at me as a cannibal. But look, I can't take my money to do anything. And this is where people like you, the NGOs, my own association, as a national secretary, I tell you, January last year, I was at the National Assembly. No, January 2 years ago. No, January last year, I was at the National Assembly to defend something that has to do with kidney health. February this year, I was again with last year, I was representing the team. This year, as a group, we went to the National Assembly. August, we were with the minister. So we are trying to speak, but there are occasional obstacles. So God is going to help us. But at least one thing is sure, we are not where we used to be. Till 2008, there was no dialysis in Ondo State, none. But today, there are at least 3 active centers in Ondo State. So we are making progress, though slow.
Thank you very much, sir. This just reminds me of I was getting a bit emotional when you were giving the statistics. That's the truth. I mean, anyway, it reminds me about the conversation we had with Dr. Onjefo, who came to speak to us about breast cancer. I think that was the one we did last year or 2 years ago. My Edison can help me with that. But we had a doctor come to talk to the teachers about breast cancer. And one of the takeaways was that because it's so expensive to treat, he then emphasized early detection and, meeting it as soon as one can, identify it. And I see in your slides, so many of our participants are asking for the slides. I see details of how we can prevent, we can take care of our kidneys, how we can make sure it doesn't get to the place where we're needing 2 million. I'm so happy to hear from you, the efforts by your association and, even the government, what they're doing. Like you said, we're not where we were, but we can still, things can be better. I can't thank you enough, sir, for this, session, for doing this with us. When the Admiral said he was reaching out to you to get you to speak to us, I was just praying that he would be successful because I know how busy it can be. So one other question I want to ask you, supplements, especially women, and then sometimes people who think they can prevent seeing the doctors by taking on supplements, the vitamins, the A, B, C, D, E, and all of that. I think one of your slides talked about vitamin D. Now, sir, what is the implication of me just going to the pharmacy and buying vitamins because I want to, stay healthy, I want to avoid the doctor's place? What's your quick answer to that? Should we be self-vitamin, taking, self-medication, vitamins and all of that?
Thank you again for that. Well, the issue of supplements has assumed a global dimension. And with due respect to the American president, I'm talking of the current American president, the way he talks, say he's a fraud, big pharma fraud. I tell you, the pharmaceutical industry is such a strong one that they have taken advantage of the space. Now, by definition, supplement is not the main thing. It's not the number one thing. Supplement is to supplement the thing. Now, before you supplement, you need to see that is there a need for it? If it's just like somebody who is still building, and then an individual is telling you the best color to paint will be a mix of white and gray. You've not plastered. So supplements should be after everything is in place. So, okay, vitamin C is deficient, or vitamin C can be, because like we're talking about vitamin D and calcium. Yes, at some age, it might be required.
Yes.
And I'm careful about my tenses, might be required. We need to, first of all, focus on the important issues. You understand? So you cannot supplement your way out. I mean, for instance, I've seen people who are hypertensive, they don't take hypertension. I mean, medication for hypertension or diabetes is taking the other things. So it is somebody that is alive that will be talking about beauty. So in my own opinion, if you get the first things first, let your numbers be okay, good BP, proper weight, good sugar control level, then oftentimes I will tell some of them, well, I'm indifferent to some of these your supplements. If you are not, because there was even a time that there was a craze about some of these supplements that they were going from church to church. Say, look, if you take this, I don't want to mention names, and the people selling were making. In fact, I know somebody who got a car by selling some of the supplement. Then somebody got killed of cancer. Somebody, if that is how it is, then there should not be any doctor in business.
On the street.
So the hype around supplements is unsubstantiated. And I mean, for instance, and we are in Nigeria, for God's sake. We need to celebrate some of the things. Yes, exactly 2 weeks ago, I wanted, because I had missed buying yam. And then he said, this is a tuber of yam. How much is it? So they weighed it. So it's, I think $15 for one tuber. In fact, my friend said, okay, man, please don't, $15.
Don't convert it.
Convert it. I mean, I don't know how not to convert because I'm earning in naira. One small tuber, 25,000 naira, like and everything. So we have mango, and we always have something in season. Some of the things you are looking for in supplements, by the time you are eating healthy, those things will be there naturally. Because if somebody, for instance, is earning the minimum with 70,000, and then he buys supplement of 100,000, he's already in debt. He will not be able to eat well. So sincerely, if you would take heed to the basic things, you don't need any, or you don't need more. That's my own thing.
Thank you very much, sir. I hear you. I hear you loud and clear. Eat well and do the right things.
Yes,
Put the supplements at the bottom of the list.
yes, please.
There's a question from Shenuga Olusegun Adedayo. Pardon me about the first name, Olusegun Adedayo. And it's a very good question, sir, because I know there are Christians around the call. And the question is, can fasting help in cleaning up our kidneys? And then what are some good fruits that, for the kidney?
Okay.
Is fasting good?
Well, I'm a pastor. And I mean, in fact, if you fast, there are times that you get your system decongested and everything like that. But you see, in this part of the globe, there is nothing we don't take to the extreme. You understand? If your health is able to take it, I mean, I will encourage you. It's good to fast. In fact, there is a way you feel when you are fasted and everything like that. And in fasting, in my own church, when you fast food, you don't fast water. So I will encourage you, and I'm talking of clear water, not Gary water. So
or pap.
or pap. So please take water, especially if your fasting is going past 3 days, take water. I mean, you are not punishing yourself. You are only, just addressing the flesh so that your spirit can be free to interact with it. And then we're talking about food that is good for the kidney.
Fruits, but you can do food too. He said
Okay.
fruit.
Well,
Yeah.
fruit is part of the food
Food, yeah.
we're talking about. On a general, in fact, it's good to look because nutrition on its own can be treatment for many of the conditions that we are talking about. Eat healthy, eat balanced diet. Don't eat late. Take small quantity meal. Don't, and then like we said the other time, especially as you are crossing certain ages, some things should be leaving your menu. You understand? And when we were growing up, I remember in the 70s. In fact, I remember an event in 1976, 77, when, okay, 4 of you come, take a bottle. 4 people sharing a bottle of Coke, and we really enjoyed it. But today, there are some people who take a bottle of Coke in the morning, afternoon, and night. That individual has definitely written an accelerated invitation to some of these things. Let's take fruit. However, if there are certain, for instance, a diabetic, there might be some fruits will say, please take less of this. So I think, and then by the time we talk about meat and all the other things, reduce your fatty intake, and all the other things like that. But by the time you are taking fruit, you are exercising well, and you're checking all the vitals, well, nobody can give an assurance, this is this, but at least you've done your own bit, and God will help us to do the rest.
Thank you so much, sir. I don't expect you to spend more than a second. Well, I don't know how long you're going to spend on this question, but I find the question very funny. I'm not a doctor. It's from Barakat Olufumi Lokpeda. Good morning, sir. My question is that can suya eating have any effect on kidney disease? My question is, can suya eating also have effect on kidney disease?
Now, suya, if you are talking about proper suya, we're talking about, of course, there are different types of suya, but most times it is red meat with spice. And the spice is usually highly salty. And you take suya according to the pocket. So, if you only take it occasionally, well, but there are some individuals that, in fact, that is their main meal. So you're taking the red meat, which is not so healthy. Then don't forget that the way we make suya, it is exposed to soot, which has been linked with gastric cancer. So much soot. It has been linked to gastric cancer. Then the spice, especially high sodium content, is also linked to elevated blood pressure and a few other things like that. So if you take it occasionally, and when I mean occasionally, maybe once in 2 weeks or something, you just have an outing. But there are some of us that every evening, as we are coming, you just take like a 5,000 worth of suya, you share out 1,000 and you take 4,000. It's not it. So that's what I would just say.
Thank you very much, sir. I want to ask you a question about what are simple tests that one can do to check the health of the kidney? I don't know if it's also possible to share, the cost if it's something that you want to put a range to. Otherwise, if you just tell us about the test. What I'm trying to do is, make it simple for the audience to know that they can, walk in and have some of these tests, and not think it's something.
Okay, so, well, the first things first. There are some things you don't have to pay for, or if you are going to pay, it should be minimal.
Okay.
What is your weight? What is your height? with your weight and height, we can determine what we call the body mass index. You don't have to pay for that. All you just need to do is to be polite. Doctor, please. They talked about body mass index. And with your body mass index, we can grade you. Are you asthenic? Are you of normal weight? Are you overweight? Are you obese? Are you morbidly obese? By the time you are going to the overweight realm, problems could be there. So that's the first thing. You know, that one we have not spent any money. The next is, what is your blood pressure? A sphygmomanometer will be used to measure the blood pressure. We know what the normal is. The systolic, that is the one on top, 120 and below, the one below 80. If it crosses over, we can talk about pre-hypertension, hypertension, which could be mild, moderate, or severe. And the higher the blood pressure, the worse the tendency. You know, that one too, depending on how you approach it, might not cost you money. But now, focusing on the other things, your sugar. Sugar can be checked fasting or random. We have the normal values. Then we can look at urine. And the urine tells us a lot about the state of an individual. And the urine assessments are also graded. So by the time we are seeing protein in the urine, we want to quantify it. We might want to repeat that protein. And if protein persists in the urine, is a reflection that there could be an ongoing kidney damage, which will make us to check some other things. And there are other aspects of the body that we look at. To check the urine, maybe between 1,000 and 3,000, you can check your urine, and they will give you, or they should be able to give you an interpretation. And then, if there are no issues, you can check what we call the electrolyte, urea, and creatinine. The creatinine is the main thing in the E and U that we look at to assess the kidney function. I think that one should be around, E and U should be around between 7,000 and 15,000. I am not exact about that. Then we check I talked about the red cell the other time. There is normal level it should have. If the red cell value is falling, it could be one of the reasons could be the kidney health of that individual. PCV alone, maybe about 2,000 thereabout, but the whole of the full blood count might be about 7,000 or 10,000, and I don't know. But really, all these things are still cheaper relative to an individual who has to now be maybe receiving blood, receiving dialysis, and all the other things like that.
Yeah, thank you very much, and thank you for putting a range to the cost, because if one plans ahead and says, especially when it comes to certain ages, and says every year I would do this for myself, I will check my kidneys out, and you have also explained that some of them don't even need to cost us money, and we're very grateful to associations like your association, and genuinely grateful. And then we also see that old students associations are doing things for themselves, like giving back. They bring people like yourself to talk to, to audiences, and then they also offer free tests. And then I know some churches also do it, some religious organizations also do it. And so what we'll advise to the people around the call, our audience today, is you have told us the cost. For those who cannot do their job and the discipline to save, to spend like 20,000 a year to test and make sure that they're in good health when it comes to kidney health, then when their churches and organizations around them give opportunities, they should try and avail themselves of such opportunities. Thank you so much, sir. I'm getting so much from this conversation. I wish my 84-year-old mom was around the call. So somebody, this is a very important question. It's almost like consulting you, sir, but we have you here for today and we want to make use of your availability. So this gentleman or lady is anonymous, says, I'm on medication for high blood pressure and my EGFR I'm sure the person knows that, yeah, keeps fluctuating, and my GP has changed my medication many times. What else can be done? Maybe you want to educate us that don't know EGFR.
EGFR means estimated glomerular filtration rate. That is what we use in putting in kidney health, especially chronic kidney disease. It is staged from 1 to 5. 1 is that is maybe a marker, but the kidney is still functioning. So the kidney function is around 90 and above in stage 1. And progressively, once it is below 15, the person is in stage 5. And that is the stage where we often offer dialysis or ask the individual to go for kidney transplant, as the case may be. Now, the EGFR is not expected to be the same. So, for instance, if somebody is 92 today, is stage 1. 99 is also stage 1. So, if the EGFR is fluctuant, we need to know what the individual means. Definitely it's beyond the scope of our discussion today.
Yes.
But GP should know, and we often tell them, by the time that the individual is in stage, in fact, we are, like I said the other time, we are writing a curriculum for the country, a guideline, as it were. When should the GP refer to the nephrologist? So if your EGFR places you in stage 4, in fact, some are saying 3B, then you can request to see a nephrologist. It might not take over fully, but it would advise and give you a note back to your GP. Changing medication. Since you are not a doctor, you cannot fault the GP who is changing medication, because at certain EGFR, certain medications should not be used. So the doctor, I believe, knows why he's changing your medication. And that is why we thank God for how things have gone. I remember in those 70s, the doctor is like deputy God, my doctor said. But now we talk of participatory healthcare. You are supposed to be involved in your health and ask your doctor, excuse me, why this? Your doctor will not be offended if you are not proving to know too much. And by the time you sit down with your doctor, only that, like I said, there are 3 active or 4 in Ondo State, and I have to see 400. You cannot engage me like that. But at least the GP should be able to give you some information as to why it's changing medication. But at least I can hazard some guesses why some medications will change. At EGFR of 15, or 30, there are some drugs that are no. So at 45, I will accept. At 30, I will say no. Even if the GP says yes, I can say no. And I would explain why it is so. And then there is nothing too significant between 59 and 49. Now, I'm not saying there is no deterioration, but I might not alter the drug. So the doctor knows, and it is good to check the EGFR because it puts the kidney function in a context for anybody globally.
Thank you very much, sir. There are so many questions, but we'll have to take a pause at some point. But I'm trying to see if I can combine some of the questions. I want to take this question because it's from a teacher. Okay. And the person says, teachers stand a lot when they're doing their work. And what's the effect of that on kidney health?
Standing is good. Let's keep on standing. Except if it becomes an issue. and you should be able to know. I mean, I stand a lot. The doctors also stand a lot. So
thank you, sir.
any
There's
problem.
another question, and it's also very important. The person says, what can, I just lost the question, but I remember it. It says, what qualifies a person to be a kidney donor?
Oh, well, that's a big question. Kidney donor. We have different types of donors. Well, let us talk in the context of Nigeria, because in different parts of the globe, we have different types of donors. We have live donors, we have deceased donors. So currently in Nigeria, what we practice is live donation. So, and from the perspective of the Nigerian regulation, we do not recognize and we frown at paid donation. We want altruistic donors. That is, you are donating because you want to. Not that you are coerced, not that you are taking money from it. So a kidney donor is somebody whose parameters are normal, and removing one kidney, because I believe he's talking with reference to kidneys. So who we have adjudged that taking a kidney from him is not likely going to worsen his health. So the person can opt to donate for a known sufferer, or can enlist that if anybody wants to receive a kidney, I'm willing to donate. So what we do is to assess. And when we assess, we adjudge that this person is fit to donate. Oftentimes, it's free. In fact, it will be free. It will be free of hepatitis B, hepatitis C, cytomegalovirus, HIV. All those things will be there. His BP will be normal. His sugar will be normal. It will be fit. It will not be a minor, and it will not be somebody too old. Most times, they donate to their relatives, or we talk of life-related, we talk of emotionally related. Emotionally related as a friend, the spouse, and others like that. So a kidney donor is, in fact, we found out that they are one of the healthiest set of people in the society. So a kidney donor is a healthy person.
Thank you very much, sir.
Okay.
Deborah Adeyemo says, if someone is urinating frequently both day and night, what should the person do?
I would just say see your doctor,
Thank you,
because
sir.
we have some scoring, we have some assessment. Because there are some people attending this meeting now, all the things that we have said, it begins to see. So some people, it's just anxiety. Yeah, so see your doctor,
True.
assess, and then he can, and oftentimes also, by the time we counsel, the symptoms will disappear. So it's good to see the doctor.
And some people win more when they're flying.
Of course, it's also related to what we are talking about. That at the point that he said, in another 10 minutes, we're about to take off, it will wee. And for 14 hours flight, some people might not even wee because it's used to some of the things.
Thank you, sir. There's a question about bedwetting. And
Okay.
honestly, I would like to be educated about this as well. So Omoyemi Aduni says, if a child is bedwetting at age 13, do we take this child to check his kidney, or is this not kidney related? And then a follow-up question, sir. You know, sometimes when we join camp, the RCCG camp, we hear testimonies of adults who are bedwetting and, you know, who get cured. But my question is just a follow-up to this lady's question about the 13-year-old. When an adult bedwets, is it also a kidney function issue? So two questions, the 13-year-old and the adult.
Okay. Bedwetting at certain ages are acceptable. So in a child and all those stuff. Now for the 13-year-old, it has passed the age that we expect that it should have attained continence of the bladder. However, we also will still have to ask questions. Is it a common thing also in the siblings, the parents? Because I've seen, in fact, I remember somebody that was brought to me at age 15. So I asked a few questions and we found out that the parents attained continence late and these older siblings also did. So, because again, if a lot of anxiety is put in the matter, the young lad might not be able to. Of course, it doesn't mean that we'll not do training and all the other things. And then don't forget, when we talk nephrology is medical, our surgical colleagues who handle this same part of the body are called urologists. So it could be a urological abnormality, but evaluation is going to let us know. And then it could be psychological. Now, if it involves an adult, a number of questions need to be asked. Has that man attained continence before? And then he starts bedwetting. What practices is he doing? A person who is a drunkard, who claims he's bedwetting, I mean, he has lost inhibition at the point that he was taking the alcohol. So it's going to be there. But when an adult bedwets, or what we call enuresis, we need to evaluate. And then appropriate therapies can be administered. And then, of course, in very advanced ages, it looks like some people undergo some regression, and then it can happen. And then we also attend to those. So it needs to be evaluated. So it has to be individualized. So the doctor would like to interact with that child, and most times they won't need medication.
Thank you very much, sir. I have just 2 more minutes. There are so many questions and they are all interesting questions. And I'm going to do something. I will just ask 2 questions and I'll let you decide which one you want to answer. Somebody says is a known diabetic, and what would you advise as, to keep the kidney healthy for a known diabetic? And then there's a second question where someone is referring to a child who has just 1 kidney. And the question is a bit confusing because they are asking that, can the child get a second kidney later? Will it be healthy? So I want you to talk, sir, about, because my husband is not a doctor, but he's doctor in the house. Sometimes we talk about that people can survive on 1 kidney. I know I've had that conversation either with him or some, just we've talked about it around. So can you please educate us on, surviving on 1 kidney, as somebody has just asked? And then can't remember what other question I'd asked. I wanted you to pick between the 2 because we don't have more time.
Well, let's not pick between the 2. Let's address the 2.
That's why. So thank you, sir.
The individual who was born with a kidney, like if you remember, Ma, when we started, we said there are usually 2. But sometimes we find out that somebody had only 1. And it just had agenesis, that this did not start at all of one of the kidneys. Yes, it's an anomaly, but they might be without symptoms till death. In fact, the findings could be accidental. That is, he just said, okay, I just had a talk, so let me go and do some investigation. Oh yeah, please do my ultrasound. Say, oh, you have only 1 kidney. Well, what would that one lead to? The person would now just need to take more caution. Because like we said, people do kidney donation. So a kidney donor would have iatrogenic 1 kidney. That is, we are the ones now that made him to have only 1 kidney. So if it can be a treatment for another individual, then actually 1 person can live on only 1 kidney. And that is why the most commonly donated organ, apart from blood, is the kidney. the only thing is that we ensure that whoever is donating is not at a potential, and I'm using the word potential risk of worsening after he has donated. If we think it might deteriorate, we will not take the kidney. So if somebody can donate, somebody can actually live with only one kidney. So if somebody is born with only one kidney, it just needs to be careful. And then we have some conditions. So that's not a candidate for kidney biopsy, for instance, and then so that's one. Then a diabetic, what should he do for kidney health? Number one, I would say it's even good that he knows that he's diabetic, because many diabetics don't know that they are. Number two, the doctor would have told him what is the normal range for your sugar. What is he expected? How is he expected to feed, and all the other things? If you just listen to his doctor, and then depending on the EGFR, like the other person mentioned, there are drugs that can be taken. And then for about 2 or 3 years now, there's a medication that has been approved to slow kidney damage or kidney deterioration that can be offered to them, and let them listen to their doctor. So that's the much I would like to say. But the diabetic should know that is at a higher risk than somebody who is not diabetic, but that you're at a risk does not mean you will fall, because there are people who were perceived not to be at risk today. If they imbibe a risky lifestyle, then it can even deteriorate faster than somebody who was perceived as being at higher risk.
Thank you so much, sir. It's like I shouldn't let you go, but I know that there are many people waiting to have you, consult or maybe handle something in the church and even the family. But I am going to be Oliver Twist, because I think Deborah Adeyemo is a teacher. I think so. So if someone is having urine leakages before getting to the toilet, what is probably wrong? I'm going to close it now so I don't ask you anymore. I'll close the question and answer box.
Okay. Well, you see, what the person is asking is, we're talking about incontinence.
Yeah.
So there are many things that can give that. But before it gets to the toilet, so that's a form of what we call urgency. Most times, please, it could be infection that is responsible for that. So the doctor will say, and if it's an overactive bladder that is giving that, it can be attended to. So it's good to see the doctor. They will usually ask the person to do a test with the urine. We call it urine microscopic culture and sensitivity. Clean urine is taken and then analyzed to see if there's any microorganism that is responsible. And then the drug that is going to attend to that will be given. And then oftentimes, men with a prostate issue also do have that. And when we assess if the the prostate should be taken out, it will be counseled and it will be done, and it will not be there. And if it is some other forms of incontinence, the appropriate treatment will be administered.
Thank you so much, sir. I'm very grateful. Can you all please put clapping emojis around the call? Let's celebrate and honor our guest speaker. So we appreciate your time and all that you have shared with us today. Thank you so much. I'm going to unmute Admiral Komolafe to help us with the vote of thanks. You're still muted, sir. Okay.
Yeah, thank you so much, Dr. Joe. On behalf of the Rehoboth Dream Solid Foundation, we want to say a big thank you to you. Like you said at the beginning, we have never met before, and just a call to you. You agreed to be part of what we are doing. It shows so many things at the same time, amongst which is the fact that you are a compassionate person and you are willing to share your knowledge so that lives will be saved. we cannot thank you enough, Dr. Ojo. And we want to also use this opportunity to thank your wife, Dr. Mrs. Ojo, who actually was the link between us and you. She assured me that mere mentioning it to you, you will accept. And that is just your passion, that you are passionate about dissemination of things like this to save life. So a lot of people have benefited today. As at last time I looked at it, it was about 230 something people. And after now, we are going to share it wide so that people will benefit further. In actual fact, like I told you yesterday, a group of people reached me from Jigawa State. And I was told that these kidney issues is a concern to them over there, and they are just waiting for this webinar. And after now, we are going to give them this tape, and I know that you will not mind them sharing it among them. And I also crave your indulgence to help me speak to them at a point, because they are eager to also speak with you. Having said that, on behalf of Rehoboth Dream Solid Foundation, we say thank you, and we ask that the Lord that we all serve will reward you abundantly. And in Jesus' mighty name. Thank you, Dr. Ojo.
Thank you very much, sir. I really appreciate it. And for the Jigawa group, I think they must be the Adejia group. We've met before, but the interaction was very brief. I'll be glad to interact with them and any group, sir. Thank you very much for having me on the call today. And once again, I want to join you in celebrating the teachers and every other person on the call. Thank you for all you do for us. You formed the foundation.
Thank you so much, sir. Thank you so much, sir. We celebrate doctors. We celebrate doctors. And we just pray that we get many more doctors. We celebrate doctors. We celebrate teachers. We can't we can't not have doctors. We cannot have teachers. Thank you so much, sir. And ladies and gentlemen around the call, I see you clapping. You're clapping. Put in the chat box. Put a bigger thank you for Dr. Mrs. Ojo, because behind every successful man is another successful woman. And behind Dr. Ojo is Dr. Mrs. Ojo. Thank you so much, Dr. Eshegon. We appreciate it. Thank you so much. I'll give the floor now to Edison. I think we still have some housekeeping because of the competition that we have. And everybody around the call, 223. Big thank you to the Rehoboth staff, the team. Thank you for this. Thank you, Shola. Thank you, Timilayin, Dorcas. Thank you so much for making sure that this was a successful webinar. Edison, over to you.
Thank you so much, Ma. There is really nothing again. I've ended the poll, and we are going to share the results. As soon as we end the program, we'll definitely get the results. So thank you. If you watch from YouTube, like I mentioned, you can use the chat box there for the referral code, which is the person's contact. The recordings will remain on YouTube, and you can go there and watch it and also share with your friends. So thank you all for yes, you are going to get the slide here. We're going to share the slide for as long as we have your email, you're going to get that. And we're also going to share the link via email so that everyone who register can visit our YouTube page to watch it. It's been very informative and really educative, and I know that we really want to thank Dr. Ojo for this opportunity, and we are really glad. So for the teachers, we'll be seeing you, the teachers that were nominated, we'll be seeing you on Wednesday. Thank you so much for participating. God bless you all. Bye for now.
Thank you. Please, if your question was not answered, could you send an email to rehobothDream@gmail.com? If your question wasn't answered and you would like us to get you an answer from Dr. Ojo, you can send an email to rehobothDream@gmail.com. Thank you to all the teachers around the call. We celebrate you. And to our friends,